Did you know anxiety disorders are the most common mental illness in the United States? Millions suffer, yet myths and stigma persist. This prevents people from seeking help. It's time to debunk these myths and understand anxiety better. Anxiety disorders affect over 40 million adults in the US alone, which is about 18% of the population. Despite being highly treatable, only about 37% of those suffering receive treatment. This is largely due to the misconceptions and stigma surrounding mental health issues. Many people believe that anxiety is just a phase or something that can be easily overcome with willpower. However, anxiety disorders are complex and can be caused by a combination of genetic, environmental, psychological, and developmental factors. Imagine feeling a constant sense of dread, worry, or fear that interferes with your daily life. This is the reality for those living with anxiety disorders. It can manifest in various forms, such as generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Each type has its own set of symptoms and challenges, but they all share the common thread of excessive, irrational fear and worry. One of the biggest myths about anxiety is that it's not a real illness. This couldn't be further from the truth. Anxiety disorders are recognized medical conditions that require proper diagnosis and treatment. They are not a sign of weakness or a character flaw. In fact, many people with anxiety are incredibly strong and resilient, managing their symptoms while leading productive lives. Another common misconception is that anxiety is just about feeling nervous or stressed. While everyone experiences anxiety at some point, anxiety disorders are much more severe and persistent. They can cause physical symptoms such as a racing heart, sweating, trembling, and shortness of breath. These symptoms can be so intense that they interfere with a person's ability to function normally. It's also important to understand that anxiety disorders can co-occur with other mental health conditions, such as depression. This can complicate the diagnosis and treatment process, making it even more crucial for individuals to seek professional help. Therapy, medication, and lifestyle changes can all play a role in managing anxiety and improving quality of life. Breaking the stigma around anxiety starts with education and empathy. By learning more about these disorders and supporting those who are affected, we can create a more understanding and compassionate society. If you or someone you know is struggling with anxiety, don't hesitate to reach out for help. There are resources available, and recovery is possible. In conclusion, anxiety disorders are a serious and widespread issue that deserves attention and understanding. By debunking myths and addressing the stigma, we can encourage more people to seek the help they need and deserve. Let's work together to create a world where mental health is prioritized and everyone feels supported. Myths create barriers. They stop people from talking about their struggles. Debunking myths promotes understanding and empathy. It encourages open conversations about mental health. Myth 1. Anxiety is just being stressed out. Truth: anxiety is different from everyday stress. While stress is a response to a specific situation or challenge, anxiety is a more pervasive and persistent feeling of worry or fear that doesn't necessarily have a clear cause. Stress can be a temporary reaction to a particular event, but anxiety often lingers and can be triggered by seemingly minor or even non-existent threats. It's more intense and persistent. Anxiety can manifest in various ways, including physical symptoms like a racing heart, sweating, trembling, and shortness of breath. It can also lead to mental and emotional symptoms such as constant worry, restlessness, and difficulty concentrating. Unlike stress, which usually subsides once the stressful situation is resolved, anxiety can persist for weeks, months, or even years, making it a chronic condition that requires proper management and treatment. It can interfere with daily life. People with anxiety may find it challenging to perform everyday tasks, such as going to work, attending social events, or even leaving the house. The constant state of worry and fear can be debilitating, leading to avoidance behaviors and a significant impact on one's quality of life. It's important to recognize that anxiety is not just a phase or something that can be easily overcome with willpower. It often requires professional help and support to manage effectively. Myth 2. People with anxiety are weak. This misconception can be particularly harmful, as it stigmatizes those who are already struggling with their mental health. Anxiety is not a reflection of a person's character or strength. It's a medical condition that can affect anyone, regardless of their background, personality, or life experiences. Truth: anxiety is not a sign of weakness. It's a real medical condition that can be caused by a combination of genetic, environmental, and psychological factors. Just like any other health issue, anxiety requires proper diagnosis and treatment. It's important to understand that seeking help for anxiety is a sign of strength, not weakness. It takes courage to acknowledge that you're struggling and to take steps towards getting better. It's a real medical condition. Anxiety disorders are among the most common mental health conditions, affecting millions of people worldwide. They can take various forms, including generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Each type of anxiety disorder has its own set of symptoms and challenges, but they all share the common feature of excessive and persistent worry or fear. It can affect anyone, regardless of strength or resilience. Anxiety does not discriminate. It can impact people of all ages, genders, and backgrounds. It's important to foster a supportive and understanding environment where individuals feel comfortable seeking help and discussing their experiences with anxiety. By breaking down the stigma and misconceptions surrounding anxiety, we can create a more compassionate and informed society that supports mental health and well-being for all. Experts agree. Anxiety is a complex disorder. It's not a choice or a flaw. Biological, environmental, and genetic factors play a role. The most harmful myth? That anxiety is not a big deal. This minimizes the struggles of those living with it. It prevents them from seeking help. Anxiety is a silent struggle that many endure daily. It can manifest in various ways, from constant worry and fear to physical symptoms like a racing heart or shortness of breath. For some, it feels like an ever-present cloud hanging over their heads, making even the simplest tasks seem insurmountable. Imagine waking up every day with a sense of dread, unsure of what might trigger your next bout of anxiety. It can be isolating, as those who don't experience it may not understand the depth of the struggle. They might say, "Just relax," or "It's all in your head," not realizing that these words can be more harmful than helpful. Seeking help is crucial, but the stigma surrounding mental health often makes it difficult. People fear being judged or misunderstood, so they keep their struggles hidden. This only exacerbates the problem, leading to a cycle of anxiety and isolation. It's important to recognize that anxiety is a legitimate condition that deserves attention and care. By acknowledging its impact and offering support, we can help those affected feel less alone and more empowered to seek the help they need. Remember, a little understanding can go a long way in breaking the silence surrounding anxiety. We've busted myths about anxiety being weakness or a choice. We've learned it's a real medical condition. It needs understanding, not judgment. Accurate understanding paves the way for support. When we understand anxiety, we can offer empathy. We can encourage those struggling to seek help. Share this knowledge. Let's break down stigma. Let's create a world where mental health is valued. Explore resources. Learn more. Your voice matters.